started 2 minutes time. Only
Okay.
one line, one slide.
Right. Right. Yes, I'm.
Your time has not completed. You can organize your thoughts.
Yes. In here, sickle cell disease is not mentioned in this scenario.
I should not have mentioned.
Okay.
Started.
Hi, I'm Dr. Shaisa, one of the doctor in antenatal clinic today. May I confirm your name and age, please?
Yeah, I'm Jennifer Dowd and I'm 30-year-old.
How may I address you?
Jennifer is fine, doctor.
Jennifer, I came to know that you are pregnant and you have a medical disorder. Is it so?
Yeah, doctor. I'm having sickle cell disease.
Okay. So, do you have any other concerns apart from this medical problem?
No, actually, I'm into my first pregnancy. I'm 8 weeks into my pregnancy. So I'm
Mm-hmm.
really anxious because of this condition, how my baby will be, how my condition will be. I just wanted to know about that.
Yeah, sure, Jennifer. I will address all your concerns in a while. But before that, is it okay if I ask you a couple of questions to know more about you so that we can go?
Yeah,
Mhm. Could you tell me more about your condition, Jennifer?
actually, doctor, I don't remember, but from the very beginning, I have been diagnosed as a case of sickle cell anemia and sickle cell disease. I do had repeated admissions, repeated pain crises, infections, everything you can name it and you can have it. But since last 2 3 years, my condition is very stable. Although I need a blood transfusion quite frequently,
Mm-hmm.
but my condition is pretty stable. I married, and then I had decided means I wanted to have a pre-pregnancy counseling, but then I got pregnant, and now I'm 8 weeks into this pregnancy.
Mm-hmm. I'm sorry to hear about that. You are going through a lot. We are here to help you out and support you. So I believe this
Are
is
you
your
feeling sorry? Are you feeling sorry for me being pregnant, doctor?
not for pregnancy, but for your medical condition, Jennifer. Because you have been admitted for a longer period and you have gone through such a difficult time. That's why.
No,
Okay.
doctor, it's okay.
Hmm. So Jennifer, otherwise, is this your planned pregnant? I can see this is unplanned pregnancy, right?
Yeah,
Hmm. So when you had your last visit to your blood specialist,
it was 3.5 months back.
okay. So are you currently on any medicines, and how far are you in this pregnancy?
I'm into 8 weeks.
Hmm. So have you started folic acid?
Yes, the GP has already started me on.
Mhm. Are you on any medicines currently?
Actually, I'm taking pain relief that is paracetamol on and off whenever I do have pain. No other medication. Occasionally, I do require blood transfusion.
So when you had your last blood transfusion?
Couple of months back. Yearly, I do get 2 or 3 transfusion.
Hmm. All right. And what about your control of the symptoms? Any pain or repeated urinary infections?
No, my symptoms are very well controlled
And
nowadays.
what about your
God's
vaccinations?
grace.
Are you up to date with your
Yes,
vaccines?
I am vaccinated properly.
Mhm. All right. And when you had your last menses?
8 weeks back, doctor.
All right. And what about your cervical screening? Are you up to date with that?
Yes.
Mm. Do you have any other medical problems apart from sickle cell disease, Jennifer?
No,
Mhm. And any medical, apart from medical problems, any surgery in your tummy or down below?
no, no, nothing.
Are you allergic to anything?
No, nothing.
Do you smoke or drink alcohol?
No.
Any recreational drugs? Pardon me for asking.
Doctor, how can I?
All right. And what do you do for a living?
I am a lawyer.
How is the support at home?
Yeah, I'm married since last 3 years, and yes, me and my husband are going well.
Any family history of same problem or clot formation in the
No, yeah,
lesions?
no, not clot formation, but when I was means when I was diagnosed, they said that my parents are carrier.
All right. And what about your partner? Has been tested for the same?
I'm married to a John, and he is actually of African descendant, and he has shifted here when he was a young kid, and he's not having any traces of his parents.
All right. So he's already tested for that, right?
No, 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 he has not been tested.
Okay. And anything else which you would like to mention which I have missed?
No, doctor, that's it.
Thank you very much for the information. Jennifer, now come to your concerns related to this pregnancy. How will be the management? So this is a high risk pregnancy in view of your medical disorder. Um, most of the time, if disease is well controlled, I can see you are not on any medicines. Most of the time, the pregnancy goes straightforward without any complications. But still, there is a risk on mother and the baby. Mother would be at risk of painful crisis, and moreover, there would be a risk of clot formation in the legs and lungs, high blood pressure, proteins in the urine, decreased blood strength, and at times urinary tract infections as well. And there could be the possibility of cesarean section and heavy bleeding. Um, but I assure you that you will be managed by our expert team of doctors. Are you with me so far, Jennifer?
Yeah.
And for the baby, baby would be at higher risk of um, baby. There would be a risk of early pregnancy loss. Baby can be small in growth. Baby can be delivered before due date, and there would be the inherited risk of same condition to the baby. We don't know exactly about your partner's screening. So what I'm going to do, I will refer your partner to genetist. So after that, we will be in better position to inform you the risk of same condition to baby. Would that be okay?
Okay.
So, as this is a high risk pregnancy, so you will be managed by our expert team of doctors, including my consultant. We will involve the blood specialist, genetist, specialized midwife, specialized nurse, counselors, GP, support groups. In the end, we will involve the baby doctor as well. So, right now, as you are 8 weeks pregnant, so I would suggest you to take higher dose of folic acid, that is 5 mg. And after that, we'll check your scan. I believe you had a scan already, right?
Yes.
Okay. So we will.
I am due for my scan actually. They had arranged a scan.
All right. So we will do the dating scan and down screening around 11 to 14 weeks, and detailed scanning of the baby will be done around 20 weeks. We will start the baby aspirin, that is S card, from 12 weeks onwards. As in this condition, there is a risk of clot formation in the legs and lungs. So we will assess your need for blood thinning agents, and most probably we will start blood thinning agents from 28 weeks onwards, and even earlier if you have more risk factors. And after that, there will be a need of repeated growth scans from 26 weeks onwards, because there is also still a risk of small baby. And moreover, we will keep you well hydrated throughout your pregnancy, and you will be seen by pain relief doctor at around 34 weeks. We will give you a trial of normal delivery if there is no complications with you and your baby. Are you with me so
When are
far?
you going? When are you going to deliver me, doctor?
We will leave you for normal delivery till 38 weeks, 37 to 38 weeks. We'll wait till that time. Okay.
Hmm.
And during the labor, your delivery and even pregnancy care will be in consult and late unit. During the labor, we will be vigilant. You and your baby will be monitored continuously. We'll keep you well hydrated, warm, and pain free. We'll avoid the pathogen, Jennifer. And moreover, we will give you the medicines to prevent you from heavy bleeding. And after delivery, baby will be seen by baby doctor. Will give you enough support, and if there is normal delivery, we will give you blood thinning agents till 1 week. And in case of cesarean session, we will prolong the blood thinning agents till 6 weeks. Are you with me so far?
Okay, yes. I'm there,
And
doctor.
moreover, in this condition, there is also a risk of repeated infection. So we will give you certain medicines like antibiotics. These medicines will prevent you from repeated infections. So we'll be vigilant for that. Okay.
Okay. Thank you, doctor.
Do you have any other questions?
No, doctor, that's it.
Mhm. Thank you very much for coming and for asking us. Anytime, if you have any problem, please you can see us without delay. I'm going to give you 24/7 emergency numbers. These are some information leaflets. You can go through them and fixing your next appointment with my consultant. And I will attach you with blood doctor as well. Okay.
Okay.
Thank you, Jennifer.
Thank you.
Ma'am, I forgot some warning signs.
What about PIL? What about support group?
Ma'am, I would tell her that. Uh, uh, Keep yourself well hydrated, warm, and stress free.
PIL, PIL, PIL. Patient,
PL, I told me.
you told? And support group? Missed out.
Oh, missed. Yes, ma'am.
Okay. And yeah, okay, okay. Uh, Now coming to the feedback. So people who would like to give her a feedback. Well done. Few points here and there. Anybody come up? Please come up.
It was a good presentation. I don't know whether she has mentioned that we'll stop low molecular heparins before, at the time of delivery.
No, she has not mentioned that.
And I didn't actually listen about the history, whether she has mentioned vaccination status.
Yeah, she missed out on vaccination, but in general, she has tried to asked me the control and organ dysfunction. Also, she missed out. So everything
Yeah.
was normal. Miss, have you been screened for any complications, or do you have any complications? Something like that. She could have said, okay.
Okay, ma'am, and is there a difference whether it's an NVD or cesarean section? Then we have to continue the low molecular heparin accordingly. What I remember, it's 6 weeks post delivery.
Yeah, 6 weeks post delivery or 3 months post delivery. You can just say that we will be with assessing depending upon the mode of delivery. You give her a broader sentence rather than fixed to the timing. Okay, if this, if that. So we will be assessing you according to the risk and mode of delivery. That is a safer option, safer points which you can say there.
Medication review once she is pregnant, ma'am.
Medication, no, she was not on any medication, Amrita.
Okay.
Yeah, only paracetamol.
She was on leave paracetamol. Even means actually it is surprising. Okay.
Yeah.
Vaccination, she asked me. Vaccination, she asked me.
Yes, ma'am, with the beginning.
Hmm. Anybody?
Ma'am, aspirin, ma'am.
Ma'am, she need to
ask about, or rather inform regarding CVS or MNO if needed, because the partner
Yes,
status was not.
yes, yes. She missed out on that, and that is, see here what it has been mentioned. See, you need to see what you have asked to do within that next 10 minutes, dear. Okay. Apart from the domains, you this is a very important things to pass the exam. So
Ma'am, actually, the partner status is still we don't know. That's why
So, no, then to all the more reason, discuss prenatal diagnosis and why it is. So this is the task you are supposed to explain me. Okay, so what you would have done then? Will you leave it as it is?
no, ma'am. If her partner is positive, then we have to go for needed testing.
Yes, so okay, so since this is a genetically transmitted condition, we would like to refer your partner for partner testing. No, doctor, he's not keen on getting himself tested. I don't know why. In that case, do you have any options regarding me? Uh, so what will be your answer then?
In that case, what are your thoughts? Are you willing for needle testing? This is the invasive test, or we have another test as well. That is the test from the blood. That is not invasive one. So, what are your
Yeah.
thoughts?
Yeah. So at least give her option. So this, see, you had been asked to do 5 points. Okay. One is obtain relevant history. Second is discuss prenatal diagnosis and why it is needed. Explain the effect of her medical condition on her pregnancy and pregnancy on her condition. Outline and justify your pregnancy and labor. So these are 5 tasks. Okay. So you missed out on one task. 20% marks cut. Remaining 80% you will get. Okay, so this way the exam goes. See, always see what you had been asked in the in the grid. Okay, in the 10 minutes, what you are supposed to do. So please ensure that at least those points should not be missed out, along with the concerns of the patient. So that one thing is missed out. Anybody else?
Contraception was discussed, ma'am. I didn't listen.
No, she has not mentioned. Unplanned at that time. What you mentioned, Shaista?
Yes, ma'am. That was unplanned pregnancy. That was, but three for last 3 years, she's symptom free.
Yeah, but that time at least you can say that once the pregnancy will be completed, we will refer you to a contraception clinic because she needs to be always on toes. She
Yes,
can,
yes.
yeah, okay.
Mhm.
One thing about that. Anybody else?
Ma'am, aspirin, ma'am, from 12
Yeah,
weeks.
aspirin from 12 weeks, she added LMWH only. Hmm?
Ma'am, I told SP.
You told aspirin. Low molecular weight heparin, I learn,
She
listen.
told aspirin. Tell about the low molecular heparin. She told only aspirin.
No, low molecular weight heparin, she said at the time of delivery and labor, we will start you on low molecular weight heparin. At that time, she mentioned that. At that time, that low molecular weight heparin, that the sentence what I didn't like is, are you why are you means you were feeling sorry when I told you in the beginning what you said, dear, that I'm really feeling sorry for you. See, I'm pregnant, I'm excited, or I'm anxious. Here those sentence will not be you, it is not a suitable sentence here. Oh, it must be tough for you. That's it. You wanted to acknowledge her situation na, or just say that it must be tough for you to carry out all these things. Some sentence, but not I'm feeling for sorry because I'm pregnant, I'm excited. I thought you're feeling sorry because I'm pregnant. So that might be taken as a lay, or that might be taken something like that. So those sentence choosing na, dear, the words na, you need to be very particular. Not every time you need to means acknowledge that how badly she's suffering. It's better if you will not acknowledge, but do not acknowledge it wrongly. Hmm? So are you happy now? Or you just change the topic. You just change the topic. So are you happy now being pregnant? That's it. Okay, her past has gone now. Her suffering has gone now. With the pregnancy, she might be excited. Something like that.
Yes,
Yes?
yes,
Okay.
yes.
Yeah. So that sentence I had mentioned is use proper sentences. You do not use such kind of sentences. Dose of folic acid I wanted you to ask, but then at the when you started explaining me, it was completed. Okay. Means basically when we decided.
Yes, folic acid to be continued throughout pregnancy, ma'am.
Yeah, folic acid needs to be continued throughout pregnancy, and then the doses you mentioned in the last. So I am not. I'm okay with that also. Low molecular weight heparin you had mentioned 445 is a in means complete timing. Okay. Um, red flags. Seek early help. What are your thoughts about that? Hmm?
Yes, ma'am, I missed those.
Ma'am, penicillin prophylaxis should be asked.
Antibiotic prophylaxis can be said here, but she's not on anything, dear. So even I was very confused here whether I should be saying. I had just mentioned that low threshold for antibiotics. We will be having low threshold for antibiotics in her
That
case.
she will be having UTIs also frequently.
Yeah, so urinary tract infection, she needs to screen for urinary tract infection also. So red flags is one thing which you need to tell her that whenever you will avoid stress factors, stress busters, you mentioned that points in the labor actually. Avoid pethidine you mentioned. Then contraception is DMPA. Okay, so DMPA is the most suitable contraception in this case. Most of the options, red flags only you missed out. So these are all two important points. Not discussing the prenatal counseling. Okay, and all these things. Okay. So let's go quickly through the answer key. Introduction and a confirm aim of consultation. I will congratulate. Okay. Rather, because although it is unplanned, but it was on her mind. So I will just say, so what are your thoughts? Would you like to continue that? Because we know that even if sickle cell disease per se is not contraindication, if the disease is well controlled, yes or no? Hmm?
Yes,
Per
ma'am.
se, yeah, if the screening has been completed, if she's been screened for her heart, her kidneys, her lungs, so per se this will not cause this will be a high risk pregnancy definitely, as you rightly said, but you can congratulate. So if you can, okay, pre-pregnancy counseling, anxious to know sickle cell disease in pregnancy, she is taking good care of her because she is not having that symptom since last 3 years, so that means she is taking a good care of her. Reassure, as a team we will work on to have a positive outlook for her and her baby. Mm, details of sickle. Very nicely, but the first thing when it has been medical history, very nicely you asked. So I can see that you are into your pregnancy and you are having some medical history. At least you remember that, okay, nothing has been mentioned regarding sickle cell disease. So this is a hidden agenda or hidden task, something like that, where nothing has been given. You will enter and you will come to know the surprise, what is a surprise package for me. Hmm? uh See, if you will go into that antenatal management and antenatal screening, that is anti means not anti this NIPT and CVS amnio, then it will be a ANC module. But if you will going to tell her implication, complications, and the risk reducing strategy, then it will be a maternal medicine medicine module. So I had mentioned both the modules. I had not stick to this as an antenatal care module. And if you have to plan this patient's labor or nearing delivery, so then it will be a delivery module. Organ dysfunction, obstetric history, first, planned, unplanned, previous pregnancy details. 10 weeks, no, it is 8 weeks or 10 weeks. Any concerns regarding this pregnancy? No. Any other medical or surgical history? No. Here, smoking, alcohol, recreational drugs, I will not ask. I will ask whether she's on any medication. Recreational drugs in medical condition, generally they do not have here dear. So recreational drugs, see to it that you will not ask time. Family history of similar condition, that is partner history, is very important. When I means you at least asked me that history. Something here, mental history can be skipped because although they had mentioned regarding booking, but it is booking under a high risk care, that is consultant led care unit. Checking background knowledge, what she knew about sickle cell disease in pregnancy, so that is checking background knowledge you need to ask. Emphasized high risk, genetically transmitted. So you need to see in fetal medicine unit either by NIPD, needle test, see whether the baby is being affected or not. If partner carrier of sickle cell disease, here the partner is not keen to get him tested. So in that case, counseling, NIPT, and needle test. Okay, so this one sentence would have marked you for that uh, task. Now coming to the effect of pregnancy on SCD and vice versa. The way you had mentioned, what are the pregnancy effect on sickle cell disease? It will increases the crisis situation, pain crisis, more means chest crisis, infection, and more frequent admission and more frequent blood transfusion. So all those complications of sickle cell diseases will be increased. Vice versa also you need to tell. So increase means what are the complication of SCD on pregnancy? Blood pressure, VT risk. What next? VT risk,
UTI, anemia.
UTI anemia. UTI anemia. And in sickle cell disease, due to pregnancy, there might be iron overload also. Means not because of blood transfusion, excessive blood transfusion, there will be iron overload also. And on baby, increased risk of miscarriages, not congenital abnormalities, but SGA and IUDs. Stillbirths are very common with sickle cell diseases. So we need to deliver them quite early. Care in pregnancy, consultant led care unit, MDT, hematologist, nurse specialist, midwife, and GP will be even AFMU, fetal medicine experts will be a part of this team. Anesthetist, neonatologist, not to forget them. Frequent follow up, low threshold for admission. Avoid stressor. Complete all pregnancy safe vaccination. That is an advised here. High dose folic acid, continue aspirin, penicillin, or if she is on any other medication, stop that, especially hydroxyurea. Continue penicillin prophylaxis if on penicillin prophylaxis. If not, check with the hematologist whether she can be offered that. Okay, otherwise, a very low risk, low threshold for starting her on antibiotics. Risk to mother, yeah, here I had mentioned preeclampsia, VT, infection, brain crisis, chest syndrome, pulmonary hypertension, CKD, UTI. CKD, pulmonary hypertension and chest syndrome, is associated with the sickle cell disease. Baby at risk of growth restriction, premature delivery, depending upon partner status, carrier. Baby might be carrier or baby might be affected with sickle cell diseases if the other person is carrier. Miscarriages and stillbirth. So what is the next plan? Now aspirin, low molecular weight heparin from early gestation. We need to screen your eye, kidney. We will be starting your vitamin D and serial growth scan throughout this pregnancy. More frequent visit, more frequent follow-ups. Seek early help whenever you will be having any problem. Okay, any problem. We will not allow you to go till term because of the risk of stillbirth. So we will offer you 30 induction of labor at 38 to 39 weeks of gestation. Here, yes, you need to explain her that stressor needs to be avoided. So epidural analgesia by anesthetist, continuous fetal heart monitoring, hydration, aim for vaginal delivery, antibiotics low threshold. Okay, and again antibiotics low threshold. One-to-one care, avoid pethidine. Baby doctor to assess baby. Babies will be tested. If not tested during antenatally, here again you can test the baby on day 5, heel prick test. Early mobilization, hydration, low molecular weight heparin after delivery, which we withhold in labor, can be continued now onward till the further need to stop. Okay, so subsequently we will be starting. Not since partner is not interested to get tested, can offer non-invasive NIPT and closing the loop. Closing the loop means offering her patient information leaflet, support group, referring her to the concerned doctors and getting her tested for other problems. Okay, so that is closing the loop. Check about and writing back to the GP, or the GP will be also in loop. So check about organ function, explore concern, partner history, take a good history, past medical history, treatment, family history, social history, current medication, review or access notes, previous health records. Information on investigations already done by GP or hematologist. Review recent investigation, especially renal function test and full blood count. Able to take concise and relevant antenatal history. Communication with patient and families, introduce self and role, able to discuss investigation, follow plan for antenatal care, including prenatal diagnosis by NIPD, able to sensitively discuss the complication of sickle cell anemia in pregnancy and how to minimize them, able to succinctly summarizing the antenatal care of this patient, involve fetal medicine team for screening of congenital malformation, delivery and postnatal follow-up, including the risk of, oh no, this was the other one, okay. Communication with colleague, consultant, hematologist, not neurologist. Uh, so here again, hematologist will be involved in, it is not be neurologist. Whenever the consultant will come up that specialty, your specialty midwife will be coming in picture. Always remember that, okay. Anesthetist, fetal medicine expert on, okay, and GP will be in the loop. No, I have not prepared the answer key. It is SCD. Conditions and the impact of SCD on pregnancy and the fetus. So ensure aware of the safety of investigation. So safety of investigation in this task will be her organ screening. Okay, when was her last visit? When was her all the investigation was done, and whether she is safe to continue this pregnancy. That is what our worry is here. Uh, Implication of pregnancy on SCD and SCD on pregnancy, drug history, safer drugs, confirm patient details at the start, safe prescription, a certain drug allergy. Here she was allergic to some powder, okay, but not that severe. Provision of patient safety and planning on pregnancy. Low molecular heparin, aspirin. This will be a safer prescription for these cases. When to continue, when to withhold. Antibiotics, low threshold for antibiotic. So all those will be safe prescription in this case. And so it is also not prepared. And the knowledge of sickle cell anemia during pregnancy is all about that. Okay. So overall, a good attempt by Dr. Shahista. Anybody wants to say anything about her performance? Shall I end it? No? No comments? Hello? Am I audible?
Yes, yes,
Yes,
ma'am.
ma'am, you
Ma'am,
are
it was a
audible.
good,
Yeah, very nice
it was a good,
presentation.
Yes,
yes.
excellent, ma'am.
But these are the, I mean, I feel that sickle cell and epilepsy, these are new hot topics for RCOG. So be prepared with them. Okay. Always see to it that what they had asked you to do and what are the concerns. All these are very lengthy topics, very lengthy topics. But please remember the concerns of the patient. Okay. Thank you,
Okay.
girls. Most
Thank
of
you,
you
Thank
will
ma'am.
you.
not be having
Thank you,
tea
ma'am.
here now. Now you just enjoy your exam. Go for exam. Once the exam will be over, I will be back with the rest of the module, rest of the task. Okay. And all the best who are exam going, because this Diwali fatakas and all those things will not